Hello everyone. So very soon I'm coming up with a webinar where I'm going to teach each and every aspect of a case taking. Whatever you want to learn about case taking, whatsoever, I'm going to explore all the areas of a case taking. How to take case taking in a psychiatric case. What is mind according to modern science? How to approach a pathological case. How do I approach an acute emergency case? Like a patient is in ICU, how do I approach those cases? What symptoms to take in such cases? How do I approach in regular daily basis acute cases like a fever and diarrhea? How do I get PQRS symptom? PQRS symptoms are the most important symptoms, but how do I get it? And how do I apply that symptoms? What is one-sided disease case taking? How do I approach in a case which is suppressed from so many years? Because despite of giving so many remedies, you're not getting the right results. How do I approach a pediatric case? So you have so many questions, you have so many doubts, because what we face difficulty is how to extract the right symptom, how to decode your mind, how to study the observations in a case. Like for instance, when a patient is talking to you and he just starts chewing his lower lip, it means he's giving you false information or he's shameful about his information. If the patient starts twitching here in this muscle when he is giving you information, it means he is giving you false information. There are so many codes you can go through when you're doing a case taking. If the patient is talking to you and is just fidgety with his hands, it means he wants to tell you something but he is not able to tell you. So there are so many things I want to talk about. There are so many things I want to share about to make your case taking journey beautiful, to learn how to explore the story of your patient. Not here, will be also teaching you how to analyze and evaluate every case. Which approach to do when, which symptom where to apply, how to differentiate the final remedy, what has to be a potency selection. Everything you wanted to learn, I'm telling you, I'm going to teach in this webinar series. You be ready to learn, because since 15 years I'm just learning and relearning from many masters, and I want to share this knowledge with you, which will make your prescription more beautiful. Because many times we don't fail because we don't have materia medica knowledge, or we do not have organon knowledge, or we do not have repertory knowledge. We fail because we are not able to extract the symptoms from the patient. So come and join my journey. It will be a beautiful learning journey for you all. I'm waiting to see you all in my webinar series. Till then, take care.